I was in a conversation over the weekend at dinner, and this guy, he works at Microsoft. I don't know what he does, but he kind of like me, is very much a comedic person. And this girl was at the table, and she was talking about how she's dyslexic and she can't spell. And the guy was like, "At least your passwords are good."
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax, HIPAA help is on the way.
Welcome to episode 444 of the Help Me with HIPAA podcast. My name is David Sims with HIPAA for MSPs, and joining me is Donna Grindle of Garden. What's up, Donna?
Wasn't ready for the 444. I thought you'd do something, but I didn't think that would be it. Fo.
I figured that might be a little bit harder. You know you're in trouble when you look at the episode number 444 and you think, 3 of a kind.
Vegas, baby.
Yeah. Hit me again.
Oh, jeez.
Yeah, man. So today we're going to be talking about the HPH CPG, the cyber performance goals. They've been released, and I saw them earlier today, and I was kind of reading through them a little bit, and then you sent me a message. You're like, "Hey, we're going to talk about cybersecurity performance goals that got released." I'm like, "Good," because I've been looking at them.
Something you've actually been reading that I throw at you.
I know.
Uh-huh.
So it was interesting as I was going through it, and you and I kind of went through them, at the same time, but not together. So our conversation can be organic.
Yeah, because usually it's so scripted and well put together.
I know. We practice and practice and practice.
Oh, geez.
Yeah. So I do want to say, though, for those of you who listen to or have ever listened to Darknet Diaries, sometimes there's some that throw me for a loop.
Yeah.
And I just got finished listening to the most recent one, which was I think episode 141, I believe it was. But dude, it took a crazy turn.
I never in all of the cybersecurity things, never saw that coming.
So we're going to try to get the guy that was interviewed on that podcast. We're going to try to get him on here to talk about it. He's talks a lot about business email compromise. And as much as I thought I truly understood all the ins and outs of business email compromise, it completely took me for a loop.
For sure. Yeah, I'll make sure that we have that link on the show notes to that episode. And years ago, when he was just starting out with Darknet Diaries, he was only a few episodes in, and we had him on the podcast. And man, he's a great storyteller. I really do like it.
Yeah. So I reached out to Jack, and it's like, hook me up, man.
I know,
So
right?
he's like, just reach out to the guy on Twitter. But anyway, we'll talk more about that if we can get him on the show and the organization that he's with and all that good stuff. But I think it'd be a good conversation that would be shocking.
Yes, very much so.
All right. So as we talk about that, something else that would be shocking is the fact that we do this for free. And all we ask is that you just leave us a review. Because we don't we don't sell any ad time or anything else. This show is completely paid for by me and Donna. And it is very excruciatingly painful money to come up with. So help a brother out. Leave us a review. We appreciate it. Thanks for those who donate, who listen every week. I'm sorry to say that we did lose our listeners in Zimbabwe or wherever they were.
Liberia. Yeah.
So we did lose our Liberia people. I told Donna, I said it was probably like a hacking gang. And when we called them out on the show as being listeners, they were like, "Oh, turn the VPNs on."
Yeah.
So here we are.
Yeah.
So let's talk about the PriceSec bootcamp, because I'm sure we'll be talking about business email compromise there.
Oh, yeah.
So April
Yeah.
9, 10, 11, 12, we will be in Atlanta, Georgia, to do the PriceSec bootcamp. Tell us a little bit about what we can expect, Donna, because I know you just got finished putting together the 3.5 day agenda.
We can expect that at some point I'm going to have to go to 4 days because of stuff like what we're going to discuss today, the HPH CPGs. We're having to include more things in our discussions, but this will be one of the many things that we'll roll that in with adopting cybersecurity practices. We've already gotten some folks from HHS to get involved, and like we did last year, and we're gonna see who else we can drag in and get involved. But the topics are basically everything that you need to have some understanding of to manage this. Whether it's like, and people are like, who should come? Anybody that's responsible for helping someone manage this or manage it themselves, not your basic workforce stuff. And if you are the compliance officer or the one that's supposed to help a compliance officer, then you probably need to come to this. So we have, there's MSPs there, IT team, practice administrators. We've had physicians there. We've had lawyers there, even some cybersecurity folks, so that they could learn about what work has to be done on the other side of this. So both business associates and covered entities and large ones and small ones. We have government agency that's subject to HIPAA. Their people come. It's a very broad group of people that end up being responsible for building and manage privacy and security under HIPAA. If you are remotely related to that, it applies to you. Go check it out, PriceSecBootcamp.com or HIPAABootcamp.com. Both will get you there. And I think the early bird price is good through March the 9th. And then the full price, which is $19.96. And if anybody can quick send, I'll give you an extra coupon for some extra money off. If you can send me an email before March 10th that why it's $19.96, and if you're in the club where I already told you why it's $19.96, that doesn't count. Club members, no, this doesn't apply to you. You get such a cheap deal, it ain't happening.
That's a good point. If you are in the club, Card Club, or HIPAA for MSPs member, then you do get a special discount. It's even better than early bird.
Oh, yeah.
So
check it out, and it's all on the website. If you have any questions, let us know, and we look forward to seeing you there.
All right. Ready to dive in?
Yeah, we don't have a HIPAA brief. We were so overwhelmed by this.
Yep, we're going
so
briefless.
We might as well get to this.
Let's do it. All right. HPH CPG. Find out what it means to me. Okay. Here we go.
Oh, we're going to have to come up with... Gonna need another song now. So this all came out January 25th. So between the time we're recording now and the time we last recorded, this is hot off the presses. Actually, it's stuff we knew was coming. I've actually seen bits and pieces of some of it. So it is what is part of the HHS concept paper for cybersecurity and healthcare that we covered, I don't know, a month or so ago. It just came out in December. And these are the first things. So that came out in December, and they said, we're going to do these things. And now here they're coming. So just know there's a lot happening. And it is moving. It's not just kind of sitting there, which is good news because this stuff is urgent. The first thing you need to know is there is a new website that hhs.gov has. And of course, we'll have the links to everything. So you can just go to the show notes. But it's the HPH Cybersecurity Gateway. And it connects you to all of the different cybersecurity projects within, and not just projects, that's not, cybersecurity resources within HHS. Is that a better way to put it?
Yep.
And along with the website, they came out with the Healthcare and Public Health Sector Special Cybersecurity Performance Goals. So what might that be? That'd be the HPH CPG. And the guide explains, it takes you through, it's really very simple guide. It just explains about the CISA CPGs, giving you a link to those, which we did discuss in another episode. So you can go back and listen to the HHS concept paper. You can go back and listen to the CPG discussion to understand what all of that means. And, but of course they're mapping them to the HIPAA practices and sub-practices that are published by 405D. And they said in their paper, since they're already doing the other things that they said in their paper, they said in their paper that they will be doing the changes that they're going to start drafting in this year. It says spring 2024. So they're drafting the changes to the security rule that they are proposing in the new rulemaking. They are drafting those changes based on these CPGs. They will be included along with, other things, but this will be like the core part of it. So there's your 405 tip, 405D tip, because it links the CPGs to HIPAA. So therefore, if you're doing recognized security practices, which I think we've mentioned about, 1,000 times.
Yeah.
If you're doing recognized security practices and utilizing HIPAA, then you're already mapped to these, or you just keep going and it'll all be handled. Mm-hmm. So you want to just stay on the course. Yes, it takes a while, but once you get there, you're maintaining, not building. And that's the thing that so many people struggle with is this is never going to come to an end. Yeah, and no, it won't.
Yeah, just think of it like a weight loss program. It's like once you get there, you just maintain it. Just maintain the weight. It's so much easier.
Yeah, you're trying to get rid of all of the attacks that are coming at you every day. So, there you go. Maintain the defenses. So they open it by saying, and this is an important statement, David, because everybody wants to know, I got to do that.
It's just voluntary.
Just like HIPAA, they are voluntary subset of cybersecurity practices that healthcare organizations and healthcare delivery organizations in particular can prioritize to strengthen cyber preparedness, improve cyber resiliency, and ultimately protect patient health information and safety.
Yeah. So if you don't care about protecting your patients, by all means, this is voluntary.
And note, it doesn't mention, it's talking about you need to do these cybersecurity practices to strengthen your cyber preparedness. Prepare for the attack, not avoid it, and improve cyber resiliency, be able to bounce back from an attack. So it's not just security. You're using the security practices to make you be ready for an attack and bounce back from it.
Yeah. I think that's a piece that a lot of people don't think about. They think about the prevention side of things, and it ends there. Like, I pay for cybersecurity, so nothing will ever happen. It's like, no, a proper cybersecurity program would have the ability to recover, respond to those things.
Mm-hmm. And it's kind of like saying I pay for insurance so I don't have to, board up my windows with a hurricane coming. I don't have to do any fire safety because I got the insurance.
Yeah.
Okay.
Yeah.
Yeah.
Don't get me started on that. I always love the insurance commercials that are always like, we protect you. I'm like, you don't protect nothing. You just come in after the fact.
You know what commercials I'm flashing to those, but they're funny. So as long as they're funny, I'm like, at least it's entertaining, interludes there. So there's no way for us to cover all these in detail, and we might break them down later. But one thing that I thought right off the bat seemed very important is they've broken it down into 2 different sections. And we've talked about that before, where the essentials are, these are the minimum things you should be doing. And then there's the enhanced. Those are your bonus points.
Mm-hmm.
And if you want a C, it's not failing. It's whether you want to get a C or an A+.
Yep.
That's pretty much it. And I would like to also point out that the essentials are above and beyond HIPAA, as it is today, which is important to note since that's what they're saying we need to change.
Yes, we do.
And none of these are specifically mentioned in HIPAA, but we're going to go through, we'll hit some highlights, but a lot of this is, it's pretty straightforward if you go and you understand any of it. And we have, in some cases, we have episodes that just talk about one of these topics. Mm-hmm. We have something about encryption. We have many about training. We have things about incident response, all of those kind of things. So some of those things we've done entire episodes just on that one topic. So go look for it. It's called Search. And you can do it on the Help Me With HIPAA website or within the app or just online. Just search Help Me With HIPAA Business Associates. Or if you're in the club, because if you're in the club, you have access to the AI chatbot. And you could also do that. Although I haven't, I think it'll do it.
Will it answer questions about bourbon yet?
I have my very own one that I have a bourbon buddy one that I built to test the ChatGPT ones. They were like, do you want to sell it? And I'm like, I don't know. It's my precious.
You should call it the brown water bot.
I might have to do that. All right. So back to where we were. Let's go through the essentials. David, what do you think?
I like the fact that they call it essentials, not basic.
Mm-hmm.
Even though it's a play on words. It's in the healthcare space, saying essential takes on a different meaning than saying basic. So I'm glad they used that. Now, it is interesting to note that they use the same verbiage like HIPAA does in saying this is setting the floor of safeguards. Mm-hmm. So this is the bare minimum, which if it would have been me, I probably would call it the bare minimum essentials.
Bare metal.
Yeah. Like this, the least you can do is this.
Yeah, that's the way you always, bring people in is that kind of behavior.
Yeah. Right. There are things in here, though, they do throw in that says basic. And I don't know. For me, I get hung up on that because different people ascribe different meanings to that word. But anyway, that aside, let's go down the list of the 10 essentials. And it's only 10, folks.
I know. Really. It's just like there's 10 practices and then sub-practices. That's what it's doing. So, but they do, when you said they do point out in summary, if you go to the hphcyber.hhs.gov page, you can like get a tour and it takes you through these with links and all that kind of stuff. And of course, there's a link to that on the website. But I did include where they said these are essential goals. And we should probably add that word. It's goals, David. It's goals. This is your goal. Have you achieved your goal? But they do say in their description of essentials that it's to help organizations address common vulnerabilities by setting a floor, as you mentioned, and then points out again, better protect them from cyber attacks, improve response when events occur, and minimize residual risk. So, improve your protections, but know it's going to happen and be able to respond, and then control the blast radius of an attack. So, here we go. Let's, you want to, we'll go, I don't know, back and forth. You do the first one, and then, we'll go back and forth. That way we can go and make sure we're opening it to the right place.
Cool deal. So we're going to start with the essential goals. I like that. First one, mitigate known vulnerabilities. All right. So that one should be fairly easy, except for the fact that a lot of people don't know where the vulnerabilities are.
Yeah, the known and how do you find them. But it's they have a little bullet, and it's all about, if it's out there. There was an article I was just reading, and I thought about doing an episode on it before, where it talked about how fast they're turning around attacks now when a vulnerability's out. Like, you used to have a few weeks, maybe a month. It's days, and sometimes hours now. So you don't have a lot of time. You can't skirt around. And you can't say, well, I'll wait and get the patch later.
And then you still got people out there that are using just crazy old stuff. I'm in a number of IT groups, and it amazes me how many times people post something like, I have a client that's still using server 2003. And I'm like, are you kidding me? They're still running their own Exchange server with some outdated version of Exchange. And oh man, it's nuts.
No.
It's nuts.
No. Just no.
Yeah.
No.
But known vulnerabilities, honestly, anything that you have is going to have vulnerabilities. If not now, then at some point. So keep up to date. You don't have to know about all the vulnerabilities that are out there for everything, because everything's not in your environment. But know what's in your environment so you can know what to keep track of. Like, for example, I don't have a Cisco anything. So if a Cisco anything vulnerability comes out, I'm not too concerned about it, because it's not in my environment, and it's not in any of my clients' environments. So I'm not worried about it. But what is in their environments, I do keep track of, and I want to know when those things come out.
Well, and you do share them with others, in the club. We do talk about it. Hey, go look and see if you have this.
Yeah.
Because it's that important.
Right.
And on the website, they do give you links to the CISA vulnerability scan. If you're not signed up for that, please do. It does an external vulnerability scan. And then there's the known exploited vulnerabilities catalog, which is different than it's a vulnerability. It's a vulnerability we know they're using to attack. It's like good bacteria and bad bacteria. There's a vulnerability there. It's a big hole. And the hiccup practices that relate to this are vulnerability management and endpoint management. I don't know if we have to go through that, though, because it even gives you the individual sub-practices that attach to each of these. So the website is really cool just to learn everything and be able to hop around. So definitely go check out the website. There's also the PDF you can download for those that are tactile and need a piece of paper.
Yeah. Or even the PDF has links to the sub practices.
Mm-hmm.
So,
but if you print it,
very
the
good
links
document.
will not work with a tap.
It'll bring up another piece of paper.
I don't get it. No. Okay.
Number 2, near and dear to my heart.
Email security.
Yes.
How many times do we need to say email security?
I mean, it's the most common way you're going to be attacked is through your email account. So, and it still shocks me how many people don't have email security, or or they think their email vendor has, great email security or any email security in some cases.
Yeah, I love that. IT takes care of it. I don't have to worry about it. Have you asked them what they do? Because you should know what they do. You need to document what security you have in place instead of just saying, I'm sure I did. 3 years ago, I'm certain that IT took care of it. What were they doing? I got nothing.
Yeah.
I have no idea.
I mean, just 10 years ago, which seems like a long time ago, but when you think about the fact that we're 4 years away from COVID beginning, I mean, 10 years wasn't that long ago. 10 years ago, you didn't really look at email security like we do today. It just, was there, and it was like, yeah, you should have it, but we need to make sure we're protecting your endpoints.
Mm-hmm.
That's kind of flipped a little bit.
Yeah. Back then, the most important thing was to have a spam filter.
Yeah. Yeah. I just get too much junk email. Can you do something about this junk email?
Yeah.
So, yeah. But looking for something that reduces the, common email-based threats, things like spoofing, phishing, fraud. Certainly, if you can have those things quarantined, don't even let your users interact with them. Like, they don't even see them. They can't click on them. It just doesn't exist.
Mm-hmm. But there are so many tricks that they use.
Oh, yeah.
That, I mean, it's a constant battle to stay ahead.
Well, one that happens a lot, and I don't hear it talked about a lot, is where, and there's probably a technical name for it, but basically they send you an email with a link. The link is not malicious when they send it. They go back later, a couple of hours or so later, whatever, then they make it malicious. Well, the link's not being scanned a lot of times after the fact that it makes it to your inbox. So that's a thing to look at, whether or not, your link is going to be scanned as it comes in or scanned as you click on it or whatever the case might be. So there's just all kind of tricks, like you said, to get around this stuff.
Oh, definitely. And they know them.
Oh, absolutely. Absolutely. So next on the essentials, MFA. We don't talk about that hardly at all. MFA. So that's something you should definitely add to everything you can possibly add it to that gives you the ability to do it.
Yeah. If you can access it from the internet, you need it secured. Whether you think you do or not, there's stuff there. There's things they can do.
And stay away from the MFA authentication through text messaging, please.
Yeah. I hate when that's my only viable choice.
Yeah.
It's better than nothing, but not a lot.
Next one, basic cybersecurity training.
Yeah, we talk about that now and then. And training a lot of times, and it's still the case that I'll go in to do training at a site and they're like, I already know about passwords. And I'm like, no, you don't. And I'm not even really going to do a deep dive on your password. I mean, if you want to talk about passwords, I can give you a trick to help you do a complex password. And everybody's like, wow, I can do that. I know.
Yeah.
Because it's not as hard as it's been forced on us to be this crazy stuff. And had we done it the right way from the beginning, it wouldn't have been where we are now. But, hindsight, very, very good vision. At the time, you don't know where you're going. You think, oh, well, 8 characters, this and this. No. So that's not training.
I was in a conversation over the weekend at dinner, and this guy, he works at Microsoft. I don't know what he does, but he was kind of like me, is very much a comedic person. And this girl was at the table, and she was talking about how she's dyslexic and she can't spell. And the guy was like, "At least your passwords are good."
You call it humor. I call it something else. Yeah.
I laughed. Nobody else did, but I laughed.
I would love to. I wouldn't have been able to hold it, you know. Did everybody get it, or they didn't laugh because they didn't get it?
I think some people laugh because other people were laughing. I don't know why that's funny, but let's laugh.
Okay. That happens. It's okay. You can ask. We're used to it.
Well, I do like the fact, before we move on though, the basic cybersecurity training, one thing it says is that make sure your users not only are learning the behavior, but they're performing the secure behavior.
And it's behavior. It is behavior.
Yep.
They are making a decision to do things.
Yep. If you're introduced to knowledge and your behavior doesn't change, then learning did not happen.
Yes. Without understanding, communication did not occur.
All right. Speaking of communication not understanding, strong encryption.
And you know, this is one that bothers me a little bit because of the way that, you know, it's like an unencrypted server, you know, they hacked in and got data from an unencrypted server.
Yeah.
I can have an encrypted server. And, you know, there are levels of encryption that would prevent that. But once they're in the server, if they have the credentials, that decrypts it. So it's the credentials and the methods of encryption that matter. And we're getting down to where we're going to have field level encryption. So even if you steal a file, you know, a whole spreadsheet loaded with stuff, I'm going to be able to set an entire column that say Social Security number. I'm going to set that whole column to say that column has to be encrypted. So I can't even see it. I can put it in there, and I have to do special things to see it and mess with it.
I like that.
Yeah, I do too, but it's not easy. But that's where I want to go.
So here's you another one that is easy to do and costs nothing,
but is often overlooked.
Yep. Revoking the credentials for workforce members that are no longer employed, including employees, contractors, affiliates, volunteers, all the above.
I think not too long ago, we were just talking about how many old IT providers logins you find on servers.
And there are a number of breaches that occurred from people that should have been removed from systems.
Yep. And the same goes. I mean, it's volunteers, it's contractors, it's vendors of all sorts, as well as your staff. Anybody that gets a login assigned or is allowed to create one, then when they're leaving, you better be on top of what those things look like and where they're going.
And this is where tracking your assets, not just hardware assets, but your software assets matter. Even if if it's a cloud application or SaaS application, because oftentimes when clients contact us and they're like, so-and-so's left the company, make sure that you change their Windows password. And I'm like, well, what about everything else? You know? and then sometimes it's things we are familiar with, for example, their email platform and things like that. But then there's a lot of technology that we don't know about. Like we don't monitor their QuickBooks accounts and their HR accounts and all these other third-party SaaS applications that they may have access to.
And they're often overlooked.
Yep. So when you bring somebody in, you onboard them, you need to have a list. So we gave them access to this and this and this and this, so that whenever they leave, you can just go back and do the reverse of what you did when you onboarded them.
And that's another thing that you often see. Oh, IT takes care of that. But there are a ton of cloud apps that IT's not handling for you.
No, absolutely.
Unless you're using the Azure directory or some other third-party SSO provider, that's another reason to use them, because I shut that one down, you out of everything. But guarantee there is in almost every business some app that usernames and passwords are not managed by any kind of IT provider.
Yep.
You don't even know they're used.
And well, the other thing is, I'll call it access creep. It's like you gave them access to these things, but after they've been there 3 years, they've got access to other stuff that never got documented.
Yeah. Yeah. I like that, access creep. Yeah. Because, the longer you stay around, people consider you a creep.
That's just for me, not everybody.
Yeah, that was just for David, everybody. That was just for David. But that's another reason that we say you need a checklist. You need a checklist that is up to date, and you complete it and you store it so you can reference it. So there's data breaches galore that happened when somebody's credentials were not removed properly. And sometimes you need to remove them in the middle of the day and they're logged into something on their phone that you can't shut down. I mean, there's a lot of things that you got to worry about. So keep that in mind. And then what number are we on?
Unique credentials. No, basic incident planning and preparedness is next.
Yeah. So do something.
That's what I said. Just do the minimum. Yeah, this one's a harder one, I think, when you start talking about incident planning and preparedness, because I think it's easier for people to come up with an incident response plan, in other words, a piece of paper. But when you start talking about preparedness, can you put this plan into action? Have you put it in action to test it to make sure it's going to work? I see most people saying, haven't got there yet.
Yeah. It's like emergency mode of operation is a required element under HIPAA. And so we're doing an assessment, and it's like, do you have a policy for this with an incident response plan? Because that should be part of it, is your emergency mode of operations. Because if you're under attack, you're going to need to trigger it. If you have any kind of other kind of, thing like, I don't know, storms, that floods, and all these other things that we have happening, so we say, have you used it? Have you done like a post evaluation of your emergency mode of operations when you can't be at your office? And all these people go, nope, never had to use it. And now I get to go, we had COVID shutdown. What did you do? Because you had to use emergency mode of operations.
Yeah.
Were you prepared for that when that happened?
And we talked about that in the podcast episode back when, it was kind of starting to go back to the office. We had a whole episode about that. Like, sit down and have conversations about what you did and document it, because you've just done some incident response.
And keep in mind, if you weren't involved back then, or you've maybe blocked it, it was so chaotic. It's such a mess. A huge problem at the time was all the laptops and all of the webcams were gone.
Yeah, they were.
And they everything that was in stock was bought out as quick as you could get it.
Couldn't get a webcam or toilet paper.
Thankfully. But my point to them was to assume that you haven't tested it. There's snowpocalypse here in Atlanta. It's happened. In fact, prior to COVID, I would talk with a lot of my folks, like, how did you handle that? Because people literally could not get to the office. If you live more than just walking distance, it wasn't happening. And even in walking distance, some people were having problems because if it was up a hill, good luck. I have to do. Okay. It's a story, and you know how sometimes a fly goes by and it requires me to tell a story. That's fun. Years ago, when I was much younger, let's say easily in my 20s, late 20s, we had a huge snowstorm. Huh?
During Prohibition?
Yeah, during Prohibition. We had a huge snowstorm, so we're kind of like snowed in, and I'm hanging out with a friend of mine who rented a house that sat up on a hill that's right in an Atlanta neighborhood, but it sat up on a hill, tiny little rental house, because, back then, none of us owned anything. We spent the money that we got because we were having parties, but we found out that the pizza delivery would still happen in the snow. But you couldn't get a car up the driveway, so you needed to try to walk up the hill. And we would order it, and the tip would be based on how many times they had to fall down. We stood and watched them fall down.
You ordered pizza for entertainment.
Yeah, we did. More than once. I know it's wrong, but I was in my 20s and bored. And we did give them extra money. The more you fail, the more tip you got.
I wonder how long it took them to figure that out.
I know, right? The people that ran right up were like, here's your normal tip. Good luck. Off you go. Gave you a couple extra bucks. You weren't that far. Okay, so back to actual work now, but I just remembered that. So, that was some funny stuff. Anyway, having a plan is more than, and how many times you say, do you have an incident response plan? IT takes care of that.
Yeah.
Haven't you've had cases where they call you and say, such and such happened, and you're like, what's your plan?
Mm-hmm. Yeah. Well, sometimes I blame IT for that because they will say things like, we're going to help you develop an incident response plan. It becomes basically a how to recover your systems plan, which is not the same as what they need.
Or how to replace them. Doesn't include that.
Right.
Yep. And well, I'm sure if I had to replace all my computers, my IT guy could get them for me. Or they handle backup or it's in the cloud. That's none of that is part. I mean, yes, those are elements that you need to know about that would be in the plan, but the plan is about so much more than that. Mm-hmm. So there you have it. And that's all I have to say about that.
So the next one is unique credentials. So again, if you're dyslexic and you can't spell, maybe this will be a good one for you. But not only having the unique credentials, but also some kind of a way to detect that activity and preventing somebody else to get in with credentials they shouldn't be using.
Yeah, if somebody's logging in, but they're going somewhere that person would never go, you want to know about it and go look into it. And that's when they use the big word there, anomalous.
Yeah, anomalous.
But it does point out you got your identity, you got your provisioning, transfers, deprovisioning procedures, authentication, and again, multi-factor authentication. Mm-hmm. So for people who are still using password 123 because they don't care, you're so far behind now, and you're probably already got somebody just watching what you're doing and using it. But
yeah, matter of fact, isn't today as we're recording like National Password Change Your Password Day or something like that? Because we were talking about it last week. I brought it up last week, and I'm like, yeah, it's time to add an exclamation point to my passwords.
Yeah. And no, it's not. It's a new phrase. Here's another one. And I have to admit that I'm really bad with this. And sometimes you can't do this, which is separate user and privileged accounts.
Mm.
So you have a secondary account that you're doing your normal work.
Yeah, this is terrible. And the smaller the organization, the worse this is.
And the problem is, in some cases, you've only been licensed for X number of users.
Mm-hmm.
And they don't take this into account. I think more vendors need to create that kind of response of, if you're doing normal work logged in as administrator, it goes into a recommendation report. And here you can have this account is my alternate account for administrator, and the account is the same license.
Yeah. Yeah. Particularly, you're talking about the cloud applications and such, right?
Well, even, server-based stuff. It's how many seats do I have licensed?
Yeah.
And some of them, smaller businesses run right up to that number, and just keep finding ways to stay right there on that number. And so that, to me, is a huge thing that the vendors could really help with. And it's certainly worth, asking the question, if I buy 50, I get 50 plus 1 kind of thing, because that's the administrator account.
Mm-hmm.
And I would love to see that kicking out on some of these SaaS, because, I review the security reports that come out of a lot of things. The Google Workspace has all kinds of security reports. Microsoft 365 has all kinds of reports. If you don't review them, if you don't know them, they're there, it's because you're not reviewing them. If you're not reviewing them, you don't know what's happening.
Mm-hmm.
So there you go. But I would love to see that kick out to say you're using an administrator account for normal day to day. You're using it every day. Now, most of what I do need an administrator account. And but that's because of who I am. And then I'll swap over in some cases, but other cases, I don't have another license to use. So there you go. That's just one opinion.
It's one woman struggle.
All right, we got at the end of the essentials, and then we can go through the enhanced. Look at us.
Yeah.
Rambling. Never happens.
We never do that. So the last one is the vendor supplier cybersecurity requirements. So identify, assess, mitigate risk associated with third-party products and services, which I think we touched on a little bit already.
Yeah, but I mean, it's the stuff we talk about. You have to vet your vendors
and
assess your vendors. It's included.
Yep.
So enhanced. Now, this is we're going to the enhanced section.
Yeah, what? I'm gonna go ahead and say, why was the first one not in the essential?
Essentials, exactly, because that is a HIPAA requirement. It is in the HIPAA law. But again, maybe somebody didn't get, so we'll just go with the fact that it's in here, because if you're not doing this, that's a HIPAA violation.
Yeah. Well, not only that, but okay, we didn't even say what it was. So the first one is asset inventory. My thing is, that's kind of a place to start with a lot of stuff. Like, if you don't know what you have and where it is, then how do you do the rest of it?
Yeah. I can't protect what I don't know that I have, or how it's used, or who has access to it, or where it is. I can't protect it.
Right. It's just, I don't know. Anyway, I think that should have been essentials, but it's not. So here we go.
Well, it's probably because they wanted 10 of each.
Yeah, that's what it was. Which one are we going to move? I don't know. But that just goes to show that just because you do the essentials doesn't mean you should stop there.
Right. The essentials are not going to, you still got HIPAA compliance to worry about.
Mm-hmm.
Mm-hmm.
Yep.
These are voluntary.
Good point. Just because you do these doesn't mean you're doing HIPAA. What do we always say? Security is not compliance, and compliance is not security.
Yep. They're two different things. They overlap. There's a Venn diagram.
Yep.
Yeah.
Okay. Number 2, third-party vulnerability disclosure.
Yes, and discover and respond to known threats and vulnerabilities in assets provided by vendors and service providers.
Yeah.
That alone is huge for vendors and service providers. Because suddenly your clients are going to be asking for that. Note to self. It's under cybersecurity risk assessment and management. So, might want to look into that. And then a perfect segue into the next one, third-party incident reporting. Promptly discover and respond to known security instances or breaches across vendors and service providers.
Yeah.
How many times do we have BAAs where we're saying, I've even had them where I have the argument, I need you to tell me within, 5 calendar days, if there's been a breach, and I want you within, if it could be a breach, I want you to tell me that you actually went through and decided it wasn't.
Mm-hmm.
And they're like, number one, we have 60 days. No, you don't. It's not a requirement for me to let you have 60 days. And number two, they'll say, we already figured it out. It's an incident. We'll let you know if it's a breach. We're only supposed to let you know if it's a breach. I want to know how you made the decision and who made it.
Mm-hmm.
I'm just saying. Just because stuff I might know. That's all I'm talking about. All right, moving along. You got two more. Those two go together. David, hit them.
Cybersecurity testing is one, and then mitigation is the next one.
Well,
So-
these kind of go together. Maybe that's why they did it.
Yeah. So, or maybe they split these out to have 10. I don't know. So, establish the processes to promptly discover and responsibly share vulnerabilities and asset discovery through penetration testing and attack simulations. So, yeah, that's where you get kind of into the weeds. Just the term penetration testing will get you in the weeds.
Mm-hmm.
I love it when somebody emails me, how much does it cost to do a pen test? I'm like, okay, hold on. We got to back up because there's 10 different pen tests. It's not, there is no pen test. There are category of pen tests. So let's narrow that down first.
Yeah, we get calls. We need you. We want to know if you'll do a penetration test. For what? So we can do our HIPAA compliance. Okay, let me ask a few more questions. There's a little bit more we're going to need to know. And, we have a client that we've had probably 10 years that originally called us for a penetration test. And once we started asking questions, they're like, yeah, we don't know what we need. Maybe we should talk to you more.
Yeah. Yeah. That's a fun conversation. And then the other one is the establish processes internally to act quickly on prioritized vulnerabilities discovered through penetration testing and attack simulations.
It's the other side of the coin.
Yeah. So once you test it, then what are you going to do once you figure out what happened?
Well, and even that you test it and like there's times where I've got a device that I can't secure properly and I find it in the vulnerability test, but that doesn't mean I go, well, I can't secure it and I'll document that. No.
Yeah.
You have to have a mitigation for it. And so that goes together.
Well, it is worth saying too that they kind of talk about it a little bit differently here. Like they say vulnerabilities in assets discovered through penetration testing and attack simulations. You can do vulnerability management without having penetration testing or attack simulations. You can do it with or without. So, but it's called vulnerability management. So it doesn't call it that here, but when you look at HIPAA and some other things, it does call it vulnerability management. So it's kind of the same thing they're talking about. They're just kind of throwing some different aspects of it in here. So don't think that you have to do pen testing and attack simulations in order to have vulnerability management. You can do with or without. You should definitely do it without. If you can afford it, do it with.
Mm-hmm. Absolutely. And then the next one, we get to have more nerdy stuff. Detect and respond to relevant threats and TTP.
Yeah.
Tactics, techniques, and procedures.
Mm-hmm.
It again is establish processes internally to act quickly on prioritized vulnerabilities discovered through penetration testing and attack simulations. So it's all kind of going together.
Yeah.
Yeah. All
So,
right. And then
again,
one of our favorites.
I think anywhere you see that term, the penetration testing, attack simulation, just throw in vulnerability management.
Yeah. Yeah, because you're going to find them there too.
Yeah, I think it helps it read better. But so the next one you love, network segmentation.
Yes. Everybody should do that. I don't care. There's plenty of ways to segment networks. Even the most basic routers today for your internet come with a gas network and a home network.
Yeah.
That you should be using.
Yeah. I don't want to hear anybody say I can't afford to do network segmentation. That's not a thing anymore.
No, and I mean, it could be as simple as a small firewall that you put in between.
Mm-hmm.
If you had to. I mean, if you don't have full capabilities of building all these virtual networks and all of those kind of things, get a cheap firewall and put it there for whatever needs to be behind it and make it go through a separate one. And then you can configure that to block traffic that goes in and out. If nothing else, kind of rig it up if you can't do virtual LANs.
If nothing else, rig it up. Here's your quote for the day, folks. If nothing else, rig it up.
Well, all these people, I got to do it with virtual LANs and we don't have the money to buy that equipment. There are other ways.
Yeah.
How
else can we solve this problem? A sneaker net. Yeah, it just becomes, a matter of asking the right questions. How else can we solve this problem? But the problem has to be solved.
Mm-hmm. All right.
Centralized log collection is next.
That one's tough.
Yeah.
That one's still, you're really enhanced when you're doing that.
Mm-hmm. Well, and then the other side of that too is, okay, you've collected the logs, but are you doing anything with them?
If you have them, it's better than not.
Oh yeah, I get it.
Yeah. At least archive them, the ones where the log only holds so much. I'm trying to get to where I can test some options, but this is, yes, if you can have a SIM or even a software version of one that's not like a actual, if you knew what these were, you know what I'm saying.
Yeah. Well,
there are many ways you could do this.
You would send me one. It was like a software version of one, maybe a month or so ago. And I went to the site and it was, I don't know, like $99 for a month or something. All right. That's pretty reasonable. I swear to you, I went back 2 or 3 weeks later and it was like $3.99 a month. I'm like, what happened?
Man, people found it. I was on the cutting edge. That's what happens.
Yeah.
Anyway, so it is something that is a harder nut to crack. It's doable. And the larger you are, the more important it is to have it. So keep that in mind. And don't forget, when you're talking about log management, you also need to be looking at the logs of access to your EHRs. And we are bad like anybody else forgetting to say, what do you do with that? Because if they make it through all these other things and get to the EHR, that log will often be the one thing that keeps you from being clueless that this is happening. You got a rogue employee doing something. You got somebody that shared their credentials doing something. Any number of things, as well as somebody gets in and downloads the entire database. There's ways that it will tell you, this seems odd. So don't forget that. All right, we're down to 2 more, David, and these are pretty straightforward.
Yep. So one is centralized incident planning and preparedness. So, a little different than the other one.
Yeah, but you're doing consistently maintain, drill, and update security incident response plans for relevant threat scenarios. And that's the thing that we try to get everybody to focus on, are relevant threat scenarios. You don't have to be prepared for everything that could happen, but if you're prepared for the top 5 things that could happen, I'm going to be able to use those for most anything else that happens.
Yeah. Just pull the most relevant playbook for what's happening.
Yeah. There you go. All right. And then.
Yeah. Configuration management. This one's fun.
Yeah. It's device defined secure.
It's words.
I'm glad we're done. It's words. Define secure device and system settings in a consistent manner and maintain them according to established baselines. So often, you can't, you go into an office, and I can tell you right now, I mean, most of ours, it's a battle just to standardize what we do, but we do, we're different. I try not to compare us to other people. But you go into many an office where they've grabbed a computer from such and such because another one died, so they move this one over there, and it literally is not configured the same way because it was used before and nobody changed it.
Mm-hmm.
And so now all the things that should be there to protect it, not there. All the things that should be there for that person to be able to effectively do their job without getting in trouble, not there. So you want to make sure it's maintained consistently. And the number of people that are like, well, I'm not going to do that. I never know what's going to come on a computer. I know. Mm-hmm. That's one of the reasons that you need to look. But, I go through mine all the time. Uninstall, because I test stuff all the time. But even then, I'm like, where did that come from?
Mm-hmm.
So staying on top of that is huge, and I don't think enough people respect it.
Nope, they don't.
Nope.
All right, that's it. There's your top 10, or excuse me, all the 10, not the top 10, of your essential goals, and then the 10 enhanced goals. And I would certainly shoot to do all 20 of those if you can. Don't just stop at the essential goals.
Yes, and it's really one of those things where what you want to be thinking all the time is, I want to make sure I'm addressing everything these things suggest I address. How am I addressing them? Either I don't have them, I don't do that, or I'm addressing them in some manner.
Mm-hmm.
That's it. All right, we're done with that then.
All righty. That's it, folks. Let's wrap this thing up. That is our show for today. Thanks for listening. Be sure to share this thing out and make sure you leave us a review. Remember, that's how we get paid, the big bucks. For Don and myself, remember that HIPAA is not about compliance. It's about patient care.
Help me with HIPAA. Let's get it right. Protect your patients day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.